A myth I see on social media is that if you've had prior abdominal surgeries, you can't have a DIEP flap or a belly-based breast reconstruction. The short answer is this really isn't true. When I see a patient who's had prior abdominal surgeries but wants a DIEP flap, when I'm just thinking about her belly, I'm thinking about two things. The first is, did her prior abdominal surgeries impact the blood flow to the flaps, or what's going to make her breast? And then the second thing I'm thinking about is, what is the blood flow to the remaining skin that's going to make up her new belly skin? I can assess the blood flow to the belly skin really just on physical exam. But to look at the blood flow to the flap, I get a CT scan. I get a CT scan on all of my patients. Studies have shown that getting that CT imaging can make your surgery faster, so I really do like it for surgical planning. And sometimes I get it because I'm genuinely concerned about whether or not a patient is a good candidate for a DIEP flap. I've had two patients who I was kind of on the edge about whether or not they would be a good candidate, and then I got the CT scan and decided it wasn't a good idea. The first was a patient who had really aggressive liposuction, and the scar tissue in her abdomen was just tremendous, and I told her that I thought the risk was really high of having compromise to the flap. The second was a patient who had an open abdominal surgery, so they had a big open scar on her belly, and they actually had cut the blood supply to the flap. They were candidates for other flaps, just not for a DIEP flap. Now, once again, this goes into the informed consent part of the surgical planning. Sometimes I'll tell patients, look, you have a lot of scar tissue in your belly. I think we can try, but it's just objectively higher risk. And then we have a good discussion about whether or not they want to proceed with that option. But if you see a plastic surgeon and they tell you that they're not a candidate for a DIEP flap based on your prior abdominal surgeries, a good question to ask is, first off, why? Are they concerned about the blood flow to the skin or the blood flow to the flap? And a second question is, do you think that other plastic surgeons would give me that same answer? Some of us are just not comfortable with doing certain procedures. Maybe it's not in their toolbox. Maybe they just don't feel comfortable doing a surgery on a patient who's had liposuction or colon-sculpting. So it might be personal preference. And remember, you can always get a second opinion. You are always welcome to get a second opinion. But yesterday I did a DIEP flap on a woman who had a urgent C-section with a vertical scar that left a fair amount of scar tissue in her abdomen and multiple rounds of liposuction for fat grafting. She was having a DIEP flap because she was concerned about the contracture around her implants, so she really wanted a natural approach. We got a CT scan and the scar tissue wasn't super concerning, so we proceeded and everything went fine. But this is a really in-depth discussion. I hope it made sense. If you have other questions, please let me know in the comments.